Thank you so much, Sue. Wonderful to be here with you. I'm going to do a little update to my bio there, just to say that's slightly outdated. I no longer split my week. That's from last time I was on. I no longer split my week, unfortunately. But I am full-time with White Ribbon Alliance, which is an absolute pleasure. So still very much connected with All for Maternity, but yeah, full-time with White Ribbon Alliance. So thank you so much for having us here, Sue. It's an absolute pleasure to be back on, and just really strange in many ways to be in a position talking about the Safer Beginnings programme, which has been my lifeblood for the last year, in working with Best Beginnings and White Ribbon Alliance to deliver this phenomenal programme of work. It feels very strange to be at a point to be talking about the end of the programme, you know, when we give so much of ourselves to these things. But also a pleasure to be here with Amity, who's worked tirelessly on this programme with me at White Ribbon Alliance, and I'm really delighted to be in a position to begin to share. So just as we launch in, I want to really offer the space to all of you watching today, all of the participants here today, just to say we are talking about some quite challenging things around Safer Beginnings. It is a programme that has been focused on domestic abuse, obstetric violence and birth trauma, FGM, female genital mutilation and female genital cutting. There are topics within what we are discussing this evening that are hard to listen to, hard to hear, and also I'm very aware might intersect with personal experience, which obviously we're not here to provide any psychological or clinical support, but really just to say I want to offer that you hold yourselves well this evening, that if things are hard to listen to, please just take a moment and step away if it's not right for you to listen to, and that is hard. And it is an introduction to what we've been looking at. We're not delving deeply into those topics this evening, but talking about the programme, we won't be skirting around some of the challenging things that we have listened to, heard, experienced in the last 15 months on this programme. So please just look after yourselves well as participants in this evening's session, and make sure that you step away if it is getting challenging to listen to at any point. So Safer Beginnings is a programme of work that began 15 months ago, and it is a real passion project, this programme of work for me, and I will start from a very personal place just in introducing it, which is that my work in maternity and birth work has always been informed by personal and lived experience. I was a victim of a very severe childhood sexual abuse and trauma and repeated rape in my childhood, and that intersection of where violence and harm then shows up in our own maternal journeys has always been something that has both fascinated, inspired and driven me really to working in this space. And so when we saw that the Department of Culture, Media and Sport were releasing programmes of work through the tampon tax funding that addressed this, I jumped on that in the first round, and unfortunately we were unsuccessful, and in the second round we were successful with this programme. So just to say, this is where we are starting from, and I will now just share my slides with you. Okay, all good. So the programme of work introducing Safer Beginnings, as I've just said, it's a self-agency programme of work that's inspired very much from a personal place of passion. And really, I've always been quite curious as to how my personal labours, births and pregnancies have been spaces for me that I actually found huge amounts of healing and huge amounts of empowerment and restoration from previous trauma because of my labours of birth. And that has challenged me in many ways into thinking, well, why when we're looking at this from a place of trauma, would my births and my labours be something that I found empowering and something that had that healing potential for me? What was that within me that led me to use my labours and births as an opportunity to find that healing, as an opportunity to reclaim a lot of the bodily autonomy that was taken from me in my early years? And it got me fascinated on this concept of self-agency. What does it mean when we actually look at what we need to heal from, to recover from, to come out of, or to avoid situations of violence and harm? There's an urgent call to action that we all know, where this intersection of violence and harm, whether that's domestic abuse, whether that's FGM, whether that's obstetric violence against women and girls, also intersects with maternity care. We're at a time in our lives when we're pregnant where we're not just thinking about ourselves, where we're also thinking about that second, that third, potentially fourth, fifth, however many children we're carrying. We're thinking about the lives of others as well as ourselves. And it's a time of our lives where we require stability and support, where if we're in a partnership or in a relationship, we're probably looking to the other parent as well to be present. So we're not just thinking about ourselves at this stage of life, we're also thinking about that whole support structure. And society around us is telling us this should be a time of celebration. We should be joyous. There should be, positivity. There's new life coming in. And often, therefore, that intersection of where violence and harm is present is something that is hugely overlooked for people entering into their maternity care from a societal perspective. And then it's compounded by where we are at the moment, this crisis in maternity, the NHS in a really, really challenging place, and the desperate disparities in outcomes that we're continuing to see for minority ethnicities within that space. All of this culminated into this project plan for the Safer Beginnings programme, which was funded by the Department of Culture, Media and Sport through the Tampon Tax Fund and delivered in partnership by Best Beginnings charity and the White Ribbon Alliance UK, alongside a number of delivery partners who I get to talk about in a moment, which is great. So the aim of the project was for us to work to create new resources, for us to work with 70,000 women by 2023, 13,000 of whom would be from ethnic minority communities in England, Scotland and Wales. And to do that, we really looked at what resources needed to be created to reach that number of people, and hopefully more, because they are resources that stay around. They are resources that are there and embedded into many different places for a long period of time. And our focus areas from the beginning of this were self-agency in relation to safety from obstetric and domestic abuse or violence, FGM and FGC. This is the best part of the programme for me, and this is the fact that at the very beginning, in the very heart, we worked in co-production with leading charities and services and campaigns, as well as specialists in the maternity sector, that made the programme really unique. And I will have eternal gratitude to all of the partners that you can see listed there, and there'll be many familiar faces and logos within that list, but we've had the joy of working with a really, really incredible cohort of partners on this programme, and also a lot of partners. It has been a very interesting space to bring 18 delivery partners together to really go, okay, what do we know from our lived experience, from the communities that we're working with, from the communities of need that we are serving? What do we know on this topic of self-agency, and how can we pull all of our voices together to begin to explore what's needed as further resources? So yeah, just a moment to really offer my deep gratitude to every single one of the partners. Everybody's been really generous with their sharings, with their insights. We faced some real challenges that we've had to get through together, just on differing opinions on what's needed and how to create things. And working with so many different people just administratively has been a real challenge. Everyone has worked tirelessly to kind of come together for this programme of work. So the format for that, and working with our partners, the format really, we came together as 18 delivery partners in a space on Zoom. All of our delivery partner meetings have been virtual, and we began discussing topics. So we would have one person leading a mini conversation, which led around the following topics. So we spoke about FGM and FGC, we spoke about sexual trauma, about obstetric violence and birth trauma, domestic abuse, stigma faced by men and birth partners, specifically in relation to violence and harm, coercion and consent, safer relationships, safer care, signposting, the art of asking, recognising violence and abuse and harm experienced by healthcare professionals as well. So where there's violence and harm present within the system of maternity itself. And within those, we then all generously shared lived experience and resources that we had, ideas that we had for what needed to be spoken to, and reached a point where we then were able to map out a series of resources that we felt were needed to be co-produced together. And at the heart of a lot of what I've spoken about this evening, you'll have heard me repeating this word self-agency, and it's very light touch. We're on limited time this evening, and there's a lot that I want to share with you, but self-agency has been at the centre of this. This hasn't been about how do we go out and just run training courses, or what do we need to change within the system. This has been about how for individual women and girls can we reach a point where people understand what it means to have self-agency? So we've obviously had to do a lot of work at looking at what does that term actually mean. And self-agency really is when something within us or outside of us doesn't feel right, and it's about having the confidence and the knowledge and the resources to enact change in our own lives. And I was very aware, as I said at the beginning, that that's something that I've somehow gained myself. So how is it that I arrive at this place of my labours and birth, having the confidence and the knowledge and the resources to enact change and to have a positive birth and labour outcome? It's about self-generating action towards safety, and it requires us to have health and social literacy, two things that are at the heart of what we do at White Ribbon Alliance, ensuring that people have got access to health and social literacy, and that our communities are there for us to turn to and support us. It's about having the ability to influence the outcomes of one's own world and experience. And to enact change in our own situation, we need to know that there's a better alternative available to us. And that's been really key and at the heart of what we've spoken about in a lot of the resources, about knowing that there is something and a better alternative. Often in situations, particularly around domestic abuse, it feels like it's hard to envisage or see that there is another way, that there is a different circumstance, a different way ahead of you that you could find that safety within. And just to say that that's also then been supported by research which is being undertaken by UCLAN, one of our partners on the programme, where Black and Asian research leads are exploring what it means to have self-agency in relation to reducing or preventing violence and harm. And that piece of work actually culminates slightly later than the end of the project. That will be available from June this year, that research piece. So what have we created? We have created Safer Beginnings content for the Baby Buddy app. Any of you familiar with Best Beginnings will know about the phenomenal Baby Buddy app. And it covers a series of films and articles that are just, I'm immensely proud to have worked on these films alongside all of the partners. And it also has written material alongside those articles to offer guidance and practical tools. A new tool which is called the Emotional Safety Plan for Baby's Sake. I could talk about this just in a whole midwifery hour itself. A brilliant new tool created by For Baby's Sake Trust, which is there to support the family to recover and ensure that you've got emotional safety. So just as we talk about creating a birth plan, an emotional safety plan is also a new tool there for us to share with people. The White Ribbon Alliance Free from Harm resource, which Amity is going to be speaking about in more detail afterwards, is a resource that contains training, offer and advice for professionals, raising awareness of harm, minimisation and during the perinatal period. And All from Maternity have also created new e-learning practitioner guides, which is for midwives and healthcare professionals on all of the topics discussed. They pull on the films that I'm soon to be sharing with you. And just so that they're there in links, if you are accessing the slides afterwards, either the links to where all of those resources will be sat. I am going to delve into one of them in a moment, but just to flag up that Safer Beginnings culminates in two conferences, one which is specifically aimed at service users and charities, and one that is aimed at healthcare professionals, and they are open and live for booking. So please, if you want to know more about this programme, meet the partners, then please do book a place. They're free to attend conferences on the 10th and the 3rd of March, being hosted by Neil Stewart. So that's great. I'm going to stop sharing on this and just come into another screen share to share with you a preview of the films, and that will be the end of my presentation. So I will just leave you with a preview of the films that are embedded into the Baby Buddy app.
Having a baby can feel like you're on an emotional roller coaster.
I wanted more children, but due to the traumatic experience I had with my firstborn, I didn't feel like I could go through it again.
When my youngest child was born, I was really worried that I wouldn't get emotionally attached to my new child.
We've created a tool to help you think about and note down what you might need from the people who will support you along this journey. It's called an emotional safety plan.
Knowing that everyone was fully aware of my situation as it was gave me lots of reassurance and confidence.
It was massively reassuring to me to have support from my husband and my midwife.
Download the plan, then fill it out with the things you need to help you feel safe, calm and supported.
Domestic abuse can affect anyone, male or female, low paid or wealthy, gay or straight.
When I was 18, I was pregnant. I experienced a lot of like mental and emotional abuse, financial as well.
I thought, well, we can't carry on like this. This is my baby we're talking about, and I don't want them to grow up feeling like this and actually believing that this is normal behaviour and this is what a loving relationship is.
Domestic abuse can take many forms, and it can be a single incident or a series of incidents, and it can be physical, coercive control, including psychological and emotional abuse, sexual, financial, and also digital abuse. If you find that someone's shouting at you, if you find that you're being called names, if you find that you're being put down, all of those things are what we would call red flags. They're things to look out for in the relationship.
Pregnancy is a great opportunity to disclose or talk about domestic abuse relationships, because often it's the first time you're in contact with a healthcare professional, or it's even the first time you've been asked about your relationship.
Anyone talking to me about domestic violence, the one thing that they're worried about is being judged. And the one advice that I would give to anyone is to don't be afraid, and there is a way out.
It's taken a lot of help and support to make it work, but it has worked. You know, we are co-parenting and getting on, and both of our children, they're happy.
Definitely reach out for help. Like, there's no shame in speaking and breaking your silence. Is actually liberating. There are services that are there to help.
It can be a little bit of a roller coaster, but it's the beginning of being safer, and that's really important. So if you recognise you're in an abusive relationship, or you recognise that you're using abusive behaviours, then it's time to seek help and support.
You know, when I look at my son and I hear him laughing and seeing him smile, as long as I can stay true to that, then I have everything I need.
When you or your partner are pregnant and just after your baby is born, you can feel more vulnerable. Part of this is because of a threat response that gets triggered automatically in our bodies. So we might protest and get angry. This is our fight response. We might feel like running away or just pretending this isn't happening to us. This is our flight response. When fight or flight are not available to us, for example during labour and birth, we might freeze. We might go elsewhere in our minds and just wait for it all to be over. If we can recognise our stress responses, we can use simple techniques to try to manage them. I'm going to share with you a breathing exercise that you can use at any time. Breathing is the quickest way to tell our body that we are safe. If we take a long, slow breath in through the nose and just focus on a longer out breath out through the mouth, that sends our body into a state of rest and digest, and it tells our body that we've got nothing to worry about.
Your pregnancy journey is something that's very unique to you, and that's why personalised care in your maternity care is very important.
Midwives are actually now working towards giving more personalised care for every woman, and this actually means taking into account spiritual, cultural, religious and medical needs for that woman.
You may be offered extra monitoring, examinations, medication or other interventions to basically try and help reduce and manage any possible risks that may affect you and the baby.
We need to be able to explore women's choices and facilitate it as best as the resources that we have allow for.
There's nothing wrong with being persistent about what your needs are. What middle ground could yourself and a healthcare professional meet?
Consent means saying yes, and that means saying yes to treatment that you thoroughly understand and have received all of the information for in a way that you understand.
If you're giving consent for an intervention, we really want that to be based on you having a good knowledge of the benefits, the risks and the alternatives.
That enables the woman to think about it and to say, yes, I agree or not, I don't agree. And in fact, it's her body. She doesn't have to agree to anything.
If you do not understand the information that has been given to you, you can absolutely ask for more time and for more discussion around the choices that you would like to make.
Ask for a second opinion, ask for them to repeat themselves, ask for clarity.
It is not like a headmaster-student situation. Okay, they are the healthcare professionals, but you are there actually as their equal.
To educate yourself, you need to think about your options around place of birth, whether you want pain relief, what your choices are in pregnancy.
Read as much as you can about what is available to you. If you've heard that you can have something, find out about it.
We had a birthing plan and we discussed things around medication, and we just spoke about, I guess, what kind of birth we wanted to have.
So we plan for what exactly you want, and then you plan for if it goes down a different pathway.
You might also find that what you thought you wanted when you're in labour isn't actually what you want. So you may find that you change your mind, and that's okay too.
Having somebody with you who understands you and is supporting you on an emotional level offers you companionship and it offers you support.
Always have someone who's there to hear the information that sometimes we don't hear, because sometimes there's so much going on.
There's this manly thing in general that you shouldn't tell anyone what you're going through. But you won't be supporting your birth partner or wife if you are struggling yourself.
Listening to your body and your gut feeling about what's going on inside your body and finding the words to explain that to somebody can make you feel physically and emotionally safer.
It is your pregnancy, it is your body, it is your decision. So always ask for what you want.
During pregnancy and birth, you'll be offered choices and asked to make decisions. It's important you understand the options and are able to weigh up the pros and cons so you can decide which one is right for you. And if you want to consent to a medical intervention that is offered. Here's a useful tool to help you make decisions. Use your brain. If you need more information from health professionals to understand the risks, benefits and alternatives, just ask.
When I started my pregnancy journeys, I knew that because of previous sexual trauma, it was going to be so important to me to have both choice and also to feel informed and to be heard. I chose to tell my healthcare providers that I had experienced previous sexual abuse.
I would consider disclosing to them your history, because it can be a really important piece of information for us as professionals to know, because it might help us understand what's happening or preempt what might be happening for you in the future.
Knowing when to say to someone, oh, actually, this is triggering me, is what self-agency is. When you have the power to say something about this, either inside of me or outside of me, does not feel right. That has to come from yourself, even if your healthcare professional has it very clearly written on your notes, previous sexual trauma.
When you have a positive experience of birth, it's going to help regain that bodily control that you lost. So there is massive light at the end of the tunnel.
I was 16 when I was subjected to female genital mutilation. I just didn't want anyone to know about it. I was ashamed of myself. I was feeling as if it was my fault. I was feeling as if everyone would now know I'm not a complete woman.
When a woman accesses maternity care, should be asked the FGM question. If she answers yes to that question, she would be referred to see the FGM specialist midwife. So it's important that you tell your healthcare professional that you've experienced FGM or cutting, because you deserve the best care, and that includes support, safety.
My first child, my daughter, was born a week late on our wedding anniversary, and that was just, it was the greatest gift I could have wished for. There's nothing to be ashamed of. There's a lot of help out there. I got the support that I needed. So don't be in silence yourself. You need to go out and seek for help. And remember, it's not your fault that that was done to you.
So thank you. Yeah, that's the introduction reel of 15 new films. So you've just seen snippets of 15 films that are now embedded into the Baby Buddy app.